How many therapists are you guys impacting at this point?
We're coming up on about 100 members. We just launched our membership a few months ago, and we've got several dozen therapists in our referral network. We get dozens of therapists at every workshop. So we're growing. I mean, our biggest barrier to reaching therapists is just having them know that we exist and reach out. We get contacted multiple times a week by therapists who are like, I just found out about you, and we're glad that there's a place where they can be curious and they can think nuanced about these issues. A lot of them feel really isolated in the field. They see how politicized things are becoming. Maybe they're self-censoring. They're worried that if they share their thoughts, they're going to be attacked. And so there's a real hunger for connection with other open therapists.
Awareness is the biggest thing.
I think so, and for therapists and for patients. We get contacted sometimes by people who are looking for a therapist, and they've been out of therapy for years. They've kind of given up. They think they can't find anyone, and they happen to see us on social media or read an article or see a podcast and reach out. And it's the same for therapists who are struggling to find a community.
Are you equipped to handle a big influx of therapists?
I mean, yeah, every day we get more infrastructure and more capacity. Our consultation groups that we run for therapists, those we divide up into small breakout groups, and then we have a big discussion. Those can be as big as they need to be. And same for our workshops. There's no limit on the capacity there.
All right, well, here's the big question. I don't want anything that you and I are talking about to make people that need help, that are looking for a therapeutic relationship, help over a rough spot in their life. I always tell people that it takes courage to reach out for help. It's easy to isolate, and it's painful, and I think sometimes destructive to isolate, sit in the closet, keep your head down. It takes courage to raise your hand and say, I need help.
Right.
And I don't want anything that you and I are talking about to say, wow, boy, this mental health field has gone off the rails, so I don't want to get involved in that.
Right.
Because that's not true. I think the vast majority of therapists that I have encountered, they sure didn't get in it to get rich.
Right.
They got in it because they care and they truly want to help and have a caring personality. And I don't want to do anything to scare people away from that, because I think that would be a mistake. I think if you need help, you should reach out for it, whether it's pastoral counseling or community therapist or community mental health center or private practice, whatever. Just make sure that the person is credentialed and, check them out, do everything that you can to find out who and what they are. But what would you say to a patient that's looking for some help and some support and guidance? What would you tell them to do to make sure that they're getting the kind of help that they want, that they're not going to be pulled into a toxic relationship that's contaminated with bias? What would be the red flags they would look for, and how would you tell them to screen for what they're after?
Well, I want to second what you said. I think there are tons of great therapists out there, and people who would be client-centered and would be curious and empathic. There are lots, and I know them personally, and I'm meeting them all the time. I think you just I would look for politicized red flags if they have signals of political ideology in their bio, supporting political affinity groups, things like that. Shockingly, a lot of therapists do put that directly on their website or their bio. It's not always hard to find. So that's easy. For those that don't, I think it's worth telling people that it's okay to talk about politics in session. It's okay to talk about faith in session. Some people think they're not supposed to talk about those issues. You can, and you can get a sense if your therapist is responding in an attuned, empathic way, or if they're closing off and avoiding those subjects. And if they are, you can raise it with them. If it feels like you're at an impasse, you can find someone else.
But you're saying that it's okay to communicate your expectations and your needs right up front. If you're with a therapist that's going to have a problem with that, you're better off to find out right up front.
Yeah. And I would pay attention to what they say verbally, but also how they react.
Mm-hmm.
A lot of people will say, oh, well, I'm not biased. But if they avoid the topic, they don't ask follow-up questions, or they communicate judgment, I would pay as much attention to that as what they say. And I would talk about it. Good therapists should ask about those things. They're important to people, they impact people, and it's worth the therapist actually opening the conversation on that. But if they don't, clients should do that themselves.
I would also tell people that there are different specialties. It's like in medicine, you have general practitioners, and then you have pediatricians, orthopedists, internists. There's all different kinds. Mental health have people that have concentrated in different areas as well. There are people that specialize in trauma. If you're someone that feels like have been through trauma, it's okay to screen for people that have specialized training in trauma. And if you're looking for marital therapy, screen for that. It's okay to have a generalist, but if you feel strongly that you have a specialized need, there's probably, depending on how big a city you're in and where you are, or if you're using telehealth in some way, it's good to try to screen for somebody that has specialized training and experience in your field, in the field that you're looking for help in. You have to be assertive enough if you're hypersensitive to or concerned about a bias in an area or someone that you're worried about judgment, you got to put it out there. And if you're not comfortable doing it, and some people just aren't assertive enough to put it out there, then, send a text message, send an email message, do something to break the ice and find out what you're up against. I've talked to patients before that said, I just don't feel comfortable asking about it. Then write it down and ask about it.
Right.
Do something to break the ice and get some dialogue going back and forth so you can find out what you're up against.
I have a colleague who's a psychiatrist who saw a patient 4 months before he raised the issue of, I've been self-censoring all my views in my life. I feel totally isolated. I don't know how to date. I don't know how to find anybody who's like-minded. I feel totally trapped. 4 months of weekly sessions before he felt, and it makes sense because somebody who's self-censoring that way worries that the therapist is going to have the same judgment as everybody else. But therapy's your opportunity to do things differently than everywhere else and hopefully get an attuned response.
Yeah. And, let that be a microcosm where you have a safe place to test some things out and do it where you're not going to get fired. You're not going to get rejected. That's a place to do some of that.
It's the heart of therapy.
Yeah.
Is actually being able to talk about that stuff.
Yeah, it is.